As I pressurize his disc, he tensed with pain. I asked him, "What's your pain level now?" 10 out of 10, he says. My name's Mark Musson. I'm an interventional pain physician. One challenge with lower back pain is determining the source of the pain. People often show up in our clinic, lower back pain, with an MRI that shows some bulging discs, and they say, "My pain is from these bulging discs." So the big question is, can bulging discs cause lower back pain? That's a good question. It is possible. Now keep in mind, as in this recent video, we showed that often with no back pain, we can see an MRI that shows wear and tear and bulging discs and arthritis, although they don't have any pain. So the bulging disc of itself isn't necessarily painful. My opinion is the disc bulge occurs from regular wear and tear or possibly from an injury. Often with an injury we can see some micro trauma to the disc that leads to the wear and tear. Often what we see is damage to the supporting ligaments that allows for more stress on the disc, and then that will accelerate the wear and tear process of that disc. So with this breakdown process of the disc, there's wear and tear. Sometimes these changes can be seen on MRI, sometimes not, as the micro tearing is microscopic. One change that we see on MRI that is more associated with lower back pain is radial fissures or annular tears. These are tears in the outer fibrous portion of the disc and are known to be quite painful. So physical exam and history can lead us into thinking the disc may be a source of pain, and really the only way to truly diagnose the disc as a source of pain is by doing discography. Sadly, as it is somewhat barbaric and painful, essentially what we do is we stick a needle into the discs that we think may be problematic or maybe a source of pain. We put some contrast into the disc, and then we pressurize the disc, and we document how the contrast flows through the disc, if there's any flow through any tears in the disc. And then we also ask the patient how their pain is. Does it feel like their usual pain, or does it feel different? Usually it's pretty clear, either severe pain, similar to their usual pain, or no pain at all. But it's quite mean. We need the patient to be awake so that they can give us this feedback as we're pressurizing the discs, and so they can describe the pain to us. With the accurate diagnosis of which, if any, of their discs are painful, then we can provide the best treatment recommendations for their pain. Make sure to subscribe, and until next time.